Do we need another Great Depression in this country to do what's necessary? Well, let's talk about that today. My name is Ed Weir, former manager of the Social Security Administration. I help people throughout the country make sure they're getting everything they're entitled to from Social Security based on my decades of inside experience. So if you are about to file for retirement, survivor benefits, spouse benefits, disability, Medicare, Medicaid, make sure you subscribe. Or more importantly, this is also a live Q&A. So it looks like I've already got a bunch of questions out there. So if you've got any questions, I'm going to talk about the topic of the day. This is about the future of Social Security and in relation to the past. I'll talk about that today. Shouldn't take that long, 5-10 minutes at the top. So this will be a short one today. And that way I can jump into your questions and answer any and all questions you have. So let's go ahead and get into it. So if you do have questions, make sure you type them in the live chat. If you are here on a recording, watching this recording, make sure you subscribe to us, and that way you can find us in the future when you or your family or friends do have questions. All right, so let me tell you a little story. In the old days, before the Great Depression, parents took care of their kids, and when the kids got old and the parents got older, the kids took care of the parents. That's how it worked for however many hundreds of millions of years or whatever, right? But there was this thing called the Great Depression that happened, and unfortunately, the kids during the Great Depression in the 1930s were barely able to take care of their own kids because they already had families at this time. So unfortunately, they weren't able to take care of their parents because they had no more money, lost everything during the Wall Street crisis and the Great Depression. And so they weren't able to take care of their parents, and their parents were pretty much just left to their own devices. And as we know through high school history, it did not work out very well. So in response to that, the people said something has to be done. At the very least, a social safety net, a minimum standard of living. The greatest country in the world, we should have a minimum standard of living so people have a roof over their head and some food, a little bit of money to to buy that. So the Great Depression kind of changed that idea a little bit. And this shock resulted in programs that probably would have never started. So this Great Depression shock of everything changing. And one of those programs that were started is Social Security. It would have, hadn't been started before, it definitely wouldn't have started after the Great Depression. So we're talking particularly, once we get into World War I in 1941, once World War World War II in 1941, December 7th, 1941, well, 1939 if you're in Europe, and 1931 if you're in Asia, with the Manchurian incident. But anyway, we won't talk about all the history there. But after World War II, then with the Red Scare and communism and all the rest of it, yeah, the Social Security, which has the word social in it, would have never started after World War II or during World War II. So the 1930s was definitely as a key component for the start of Social Security. And where did Social Security get a start? Well, in the world, the first country that adopted old age insurance was under the German Chancellor of Otto von Bismarck, the Iron Chancellor there in Germany. He started it in 1889. So we started ours in 1935. And it's interesting, people think that we picked the age of 65 for retirement because good old Otto was 65 when he started. But actually, it was when Germany first started, it was 70 years old. They didn't adopt 65 years later. 65 years is a retirement age until many years later. But then we copied it for them for the 65. And of course, we increased it starting next year, 2025. Now it's fully 67 years old. And there is talk out there about increasing the retirement age again, which I personally am completely against. And pretty much everybody that has joined me on my live Q&As agrees with me so far. But during the Great Depression, there was a lot of negative views of Social Security, a lot of criticism, a lot of things that had to be overcome for FDR to pass it. It would, if we do this, Social Security is going to make people lazy. They're not going to, they're not going to go to work. They're just going to Reagan, the welfare queens, and all the rest of it. That was kind of the same type of thing in 1935. Not obviously not that terminology. The Social Security Trust Fund with just a bunch of worthless IOUs. I've did a video on that a while ago. So this whole worthless IOUs thing has been around since basically the beginning, 1935, 1937. And worthless IOUs haven't had a Social Security check bounce since 1935. It's Social Security is socialism, it's communism, and all the rest of it. So it was amazing that it was passed. And the only reason Social Security Act was passed in the first place was because of the Great Depression. So we are at that kind of juncture right now. We're at a critical time approaching where the baby boomers, those 76 million Americans from 1946 to 1964, are finally retiring, and they are coming and starting taking their money that they paid into. And that's one of the reasons the trust fund was started in the 1980s to begin with, was to prepare for those baby boomers. And of course, the trust fund is going to disappear because that's what it was designed for. Social Security has had a trust fund, and then they depleted it, had a trust fund and depleted it. That's how it works. But normally it's a pay-as-you-go type system. But the problem is population, there's less kids coming up paying into FICA tax, the Social Security tax, and there's more money going to the top 1%, top 10% who are not paying FICA taxes, because anything over this year, $168,600, you don't pay Social Security tax. So everybody on here probably watching, 99.9% of you pay FICA tax, Social Security tax on all your income. But if you're making a couple $1,000,000, you don't pay it on that other money over $168,000. So more of that money is going to the top, and therefore less money is going to Social Security. So 2033, 2034, we see different years going back, not very far in the future. 9 years is not very far, 9 or 10 years. They're looking at a 20% cut in benefits. So look at your check, what it comes in the direct deposit, what you're planning to get, subtract 20% of that, and it's not going to be good. So how do we get that changed? Well, there's a lot of politicians out there that just want to kind of kick the can down the road in order to kind of eventually privatize Social Security, wait for the emergency to happen. Don't do anything to solve it. Just sit there and talk about, well, there's no perfect solution. There's no perfect solution. And kick the can down the road until it's a 100% emergency where you're about to cut your checks, and then they come up with some terrible idea that we would never agree to, but it's too late. Or we can do something now and get it changed. So whatever your political leanings are, I would recommend, based on my decades of inside Social Security, helping people, helping millions of people with Social Security, they are dependent on their Social Security check. They cannot take 20% cut. So I'm essentially appealing to everybody out there to protect Social Security, and obviously Medicare as well. So there is my spiel on that. I only took 8 minutes of your time. And now let's get into your questions on all things Social Security. And if you have any comments on the future of Social Security, how it should be solved, definitely jump in there. But if you've got any other questions on retirement, survivor benefits, all the rest of it, please, let's see what we got. All right. First, Kathy. What's up, Kathy? Sister is 64 years next week, 64 years old. I love this Kathy. I like people when they look out for their family and friends and stuff. That's awesome. And her husband was the same age. He passed away 2 years ago. If she applied for Social Security today, can she draw on her smaller benefit and keep survivor benefit until she is FRA? Yes, that is one of the things. You can do it either way. If the person is living, the spouse is living, divorced spouse or whatever the case may be, you have to file for benefits on your own record first. You have to file for benefits on your own record first, and then a spouse benefits. But survivor benefits, you don't. So in terms of survivor benefits, she can go ahead and file for benefits on her own record, wait till her survivor benefits increase. And the only way it would increase, obviously, is because you're delaying starting those benefits. But one thing on survivor benefits, but her husband passed away 2 years ago. So it really depends if he was already taking benefits, if he filed for benefits early, if he was on disability, if he didn't file for benefits, whatever the case may be. Survivor benefits are calculated kind of differently based on the deceased when they took their benefits. So what I would tell your sister is to check both options. So when she calls, I would tell her if she wants to go ahead and start those benefits, call the 800 number, schedule an appointment, and then say, okay, if I start benefits on my own record, how much will I receive if I start this month? And then she says, okay, if I start benefits on my own record and I wait till next year, how much will I receive? And then, write it down on a little piece of paper there and say, okay, if I start survivor benefits this month, how much will I make? If I start survivor benefits next year, how much will I make on survivor benefits? And then she can make a perfect comparison of how much one is going to increase, whether one is not going to increase, and all the rest of it. So, but hers will continue to increase until she hits her 70th birthday, because she gets those delayed retirement credits. So that is my recommendation. Find out those four numbers and then decide which to take first. Take retirement first and then switch to survivor benefits later, or take survivor benefits and switch to retirement benefits later. Okay. Um, Dr. Ed, if a pensioner lives in the Philippines, can his wife and son receive monetary benefits? Wife does not have Social Security number because she's never been in the U.S. So you have to have some type of legal status. You don't have to necessarily live in the United States, but a person to receive Social Security benefits, contrary to internet myths, you do have to have legal status in this country. So in order to receive Social Security benefits, U.S. citizenship or a green card, some type of legal status in the United States. So they will need to apply for that and get a Social Security number and all the rest of it. So let's see. Eric, on spousal benefits, my spouse passed. Her income history was not as much as mine, as I was the main breadwinner. Can I still get spouse benefits? Yes, Eric, same type of situation. You can get survivor benefits, and you don't have to touch your own. If you've already started your own and your benefits are more, then you're pretty much done. But you can collect the lower survivor benefits while you're waiting for your benefits to increase. I finally got a Social Security agent to tell me the truth. I'm 60 and I haven't received my Social Security of my spouse who died. I was told 60 days. She looked, I'm at 70 days. She sent to expedite. I will get 100% 1 or 2 weeks. She said, all right, good deal. Good deal. Yeah, sometimes it takes to be persistent, aka annoying as heck. But hey, happy Friday. If I start my Social Security at 67, but keep working, will Social Security reduce my benefit because I'm still working? No, because you're your full retirement age, your benefit could increase. Obviously, it will increase based on COLA. Don't know what that's going to be. Hopefully, the numbers come out pretty quickly. Should come out this week or next week. But no, if you continue to work and pay into Social Security, and that's one of your high 35 years of earnings, then Social Security will automatically recalculate. And if you're due more money, they will increase that benefit, but it won't be reduced. It's not the whole $1 for every $2 you go over. You're not subject to that anymore because you're past your full retirement age. Let's see. Zippy. I started collecting SSDI January 2020. My onset date, August 2019. Awards letter started CDR 5 to 7 years. I'll be 60 soon. Does SSA go back to onset date or date you received SSDI for the 5 to 7? The onset date. Yep, it goes by the onset date because people, I'm sure they file an initial claim that takes 6 to 9 months. Then they file a reconsideration. It takes another 6 to 9 months. And then they go to the ALJ, the administrative law judge, and that takes a year or two. So you could wait 2 or 3 years. But yes, it goes by your onset date. Pretty much everything goes by your onset date, and also your Medicare goes by your onset date as well. So and the CDR, they put a little pause on CDRs, but I think they're restarting the CDRs. But my philosophy on CDRs, continuing disability reviews, is forget about it, complete it, and forget about it. FCF. So forget about the CDR. When you get it in the mail, then complete it to the best of your knowledge. Come back here, and we can walk you through the process. But forget about it. It's. I've done some videos on CDRs and why I said that. So. Let's see here. Got cut off. Why not awarded? Agent said you are 60 to 10 days, 1 to 2 weeks later. She's the only one to answer me. The others so negative. Does this sound right? Yeah, really, I'd have to look at your case, and obviously, I don't have access to the computer system anymore, so I can't look at your case. So, but if she says, whatever your situation is, that she's going to go ahead and expedite it, then yeah, I'd give her the week or two. Again, Social Security. This is the design. This is how Social Security was designed by politicians to give customers terrible customer service. They have pretty much cut the agency. It's the worst staffing levels in 50 years. At the same time, baby boomers are are increasing. So politicians, this is a designed plan to destroy customer service. So y'all just give up and say, forget about it. Just give it to Wall Street. Give all the trillions of dollars to Wall Street. So that's the plan. And I've I talked about that. I've got the the manifesto essentially of that plan that was made in the 1980s. Good afternoon. If I'm on disability and apply for my survivor benefits, will my payment be full amount or will I get half of my deceased husband amount? No, the half thing is if that's for living spouse benefits. So for survivor benefits, you get up to 100%, but it's minus your own. So a lot of people are scared to get spouse benefits or divorce spouse benefits or survivor benefits because they think that will affect their disability and therefore their Medicare. It won't. So please call, and find out how much those survivor benefits will be. And if they're $1 more than your disability benefits are right now, then you'll get that extra dollar. If they're $100 more, then you'll get the extra $100. And again, it won't affect your disability or your Medicare. So too many people are worried about that, and they're just leaving money. So please like, subscribe, share, so we get more people out there that get their money. Bill, is there a program to help while waiting to get approved for disability? I have multiple heart issues, among other issues. Currently in 58, doing DoorDash, but not sure how to survive. Unfortunately, because you're 68, what I usually tell people is, if they go ahead and file for disability, and rather than waiting for that check to come in, 6 to 9 months, I tell them to go ahead and file for retirement benefits, but you're too young for retirement benefits. Other than that, there's welfare type benefits in your particular area. I did a video, so check out this video right here, the one on the bottom, how to live how to live on Social Security alone. And there's over 45 different programs that I outline in that video, and hopefully one of those will help you out. Oh, not that one. All right. And you can find that on my YouTube channel under the videos part, not the live tab, but the videos part. Dr. Ed, thanks for all the excellent information, but I need some help and clarification. I have talked to 4 different brokers and get different answers on the state of Illinois birthday. Yeah, I've just partnered. I've started a partner with, I've had the same issue with brokers and all the rest of it. So I just did a brand new partnership with, I would argue, well, I 100%, I wouldn't partner with them if they're not, I don't think they're the best in the country, but these guys are phenomenal. So click that little QR code, or call my number, the 888, and then press number 1, and you'll immediately be contacted with the company I just partnered with, and they are unbelievable. So, and they are one of the main reasons I did is because they're pretty much the only large organization in the country that helps with Medicare, and they I call it the miracle on 34th Street business philosophy. I don't know if people watch the old Black. I guess they remade it, but Miracle on 34th Street. Remember Santa Claus working as a Santa Claus, and I think it was Macy's, and he told the little kid, "Oh, that little fire engine, you can get it cheaper down at Gimbel's." So that's it's regardless of what's, if it's going to make the customer, the kid happy, send them somewhere else. So the company I just partnered with has that philosophy, which I like. It's, hey, the ones, the carriers, they represent thousands of, hundreds of different insurance companies throughout the country. But if they just don't happen to, represent yours because you're the best insurance in your particular areas is one small little company, then they will tell you that hey, this one's the best one for you. So they're basically the only ones that will do that. So I just partnered with them. So yeah, um, I'm very, very happy that I was able to finally come up with that partnership. Zippy, question: does Social Security go back to onset date or date you received SS. Okay, I already answered that one. Hey, they will deny my claim for spousal benefits in a few days if they can't get in touch with my husband, who I have not seen in years. What can I do? Yeah, so you're filing for the independently entitled divorce spouse benefits, and one of the difficult things on that is because they want to make sure they give you the right benefits, and because your ex-spouse hasn't filed for benefits, sometimes, yeah, it's kind of a super gray area. But if um, here's what I recommend: if you just don't want your ex-husband, your ex-spouse to be contacted, and then you just tell them, you do not contact. There's some type of issue there. You know, it's a safety issue, or whatever the case may be. Tell them I do not want him to be contacted. And what they should be able to do is say, okay, because you're getting benefits on that person's record, we need to make sure that person's record is correct in terms of earnings and all that kind of stuff. We're not going to get that person's permission. We don't need that person's permission. We just want to make sure the benefit amount is correct. Like, sometimes, people, oh, there was $1 million here in 1982. That's not my $1 million. And so they take it off there, and, but you can, what they should be able to do is say, okay, we're not going to contact your ex, but because of that, your benefit amount might be incorrect. There's 99% chance it won't, but it might just be incorrect. If he files next year or 2 years from now, and he says, hey, that $1 million is not mine, then you're going to get, a few dollars extra every month. So they might just say, okay, they might have you sign something that says, okay, I understand that, that the benefit amount might be correct, and I will repay the overpayment. Usually it's not that much. So but if you just don't want your ex to be contacted, or they can't find your ex, then please tell them to make other arrangement and say, hey, I understand that, I might get a few dollars more or less. My benefit amount might not be correct. Again, usually it's 99% of the time it's perfect. Birthday rule: can I switch to another insurance carrier without underwriting? Yes. So yeah, some states have the birthday rule, which is interesting. Yeah. So you just, for the Medicare supplement, this is Medicare supplements. Usually on Medicare supplements, if you don't get them at 65, or when you're first new to Part B, you have to go through medical underwriting. But some states say you don't have to do that. Some states, you have a birthday rule where you can do it without underwriting. So again, I would call my number there and press 1, and you'll immediately be connected with my new partner. Or I always get it wrong here. Or click on that little QR code, and it'll bring up a little list, and you can fill out the little form there, and they'll contact you. So yeah, I'm so happy. That's awesome that I was able to partner with this new company. I don't understand why Medicaid can negotiate drug prices and Medicare can't. Well, they now can. Finally, after what Medicare started in 1965. Yeah, so they haven't been able to negotiate drug prices, since 1965. It's crazy. And people will say, Part D didn't start till this. Part B had drugs since 1965, infusions and stuff like that. So yeah, it's crazy. Yeah, Roxanne, don't think they don't, yeah, they probably would like to make sure the benefit amount is correct, but yeah. How come we aren't capping income at 400? Capping income. Well, you're probably, the current president's, vice president, their idea to shore up Social Security is to raise the cap, which I am 100% in agreement with, and pretty much everybody that has joined my live Q&As agrees as well. And that, again, you pay you pay FICA, Social Security part of FICA, on all your income up to 168,600. After that, they don't. But the current plan is to not um, put FICA subject to FICA from 168,600 to 400, and then for 400,000 and above, FICA for all of it. So there's kind of like a donut hole there. I don't think it should be a donut hole, so I disagree with that policy. But I think they did that so it makes it easier to pass, uh, Congress and stuff like that. So yeah. The population doesn't need a Great Depression. It needs a House of Representatives that will slash and I earn my Social Security. Yeah, yeah. I was being kind of facetious, and yeah. I mean, it's come on. Is this what we need for politicians to do what needs to get done? They know something needs to get done. It's just they want brinksmanship, and so yeah. I agree with you. I think that they just need to do what we need to tell them to do. I am now 67, went on SSDI age 58, called Social Security at 66, and they said, not much difference, zero difference. Well, I would like the difference, called Social Security several times. It lasts for 3 hours. How can I get the appointment? Yeah, there is no difference. Yeah, in terms of money, you're going to get the same benefit amount. So whatever you were getting the day before you turned the full retirement age and you were on disability, and then you turned your full retirement age, and then you're on retirement benefits the next month. That's all that happened. They stopped taking your money out of the disability trust fund and start taking out of the retirement trust fund. Your benefit is exactly the same. There's no change whatsoever. The only change is you're no longer on disability. You no longer have continuing disability reviews. You no longer have work limitations. So, but in terms of the benefit amount, it's the exact same. So don't waste your time trying to get more. It's the same. I served in the military 78 to 98, my dates. Yeah. So just make sure when you filed your Social Security application, always make sure you notify them of any military service. If you don't remember, if you did, call the 800 number. They can check to see if your military service was included in there. Doesn't make a whole bunch of a difference, but hey, a buck's a buck's a buck, right? Um, uh, yeah, that's why they told me that they had to speak with him first. I had my appointment last month. They said nothing can be done if they can't reach him. My claim will be denied. I'm 67. He's 63. Yeah, if they deny your claim, then immediately file a reconsideration, SSA 561, and say, hey, I'm entitled to independently entitled divorce spouse benefits. And yeah, yeah. So again, maybe under the assumption, the recognition, the acknowledgement on your part that, okay, my benefit might be plus or minus, $5, $10 or something like that. So, or it's usually it's not. When I do start receiving, I am sending what I can to you. You have helped me the whole way. Hope is what we need, and you are in my prayers. Oh, thank you. I appreciate it. Yeah, I don't need to sit all my weight, but you can buy me a beer. Remember, one beer Weir. All I need is one, or a coffee. Can you be deemed disabled by Social Security and not receive a check? Yeah. Um, People that, yeah, I can think of several reasons. Um, but one is if you worked for a government entity, state, city, local government that did not pay into Social Security, but they paid into Medicare. So it's a Medicare only claim where you're determined to be disabled, but because you didn't pay into Social Security, you don't get the money, but you did pay into Medicare. So therefore your Medicare starts after 2 years. So yes, it's possible. Mm. My mom came of age during the Great Depression, rough times. Yeah, she appreciated FDR. Yes, yes. Um, Dr. Weir, will it hurt if we quit paying taxes on Social Security received? I read it only started being taxed in 1984. Well, will it hurt? Maybe not physically, but well, yeah. I mean, it's um, between you and the IRS. I served in the military from 78 to 98. I'm supposed to be credited an additional $100 for every 300 is active duty. How do I get this applied to my Social Security account? Yep, just call them up. And yeah, it's just basically what it means. You're not going to get an extra $100 in your check. It basically means, hey, in 1980, you were there and you made $10,000. So instead of $10,000 being posted, we're going to post $10,300. So it doesn't make a whole heck of a lot of difference, but again, over 10, 20 years. And so just make sure they credit your record. All they have to do is call the 800 number. They can look at the MBR, the master beneficiary record, and they can see a little entry there that says your military was accounted for. Bobby received payment from former employer in 2024. It will cause IRMA in 2026. Can I apply for Social Security now? Request retro pay to June and let Social Security payments begin next year. I'm 70. If you're 70, yeah, you should be. Hopefully, you're collecting your Social Security benefits because the month you turn 70, your benefits don't increase anymore. But in terms of IRMA, if you received money 2 years ago from any kind of work source type like that, and you have since stopped working, then submit an SSA 44, and that is a life-changing event, and says, yes, I worked 2 years ago. I made over 103,000 if you're single, 206,000 if you're married. Yes, yes, yes. But I quit last month, a year ago, 2 days after I got that check or whatever the case may be. And that's a life-changing event, and you won't get charged the IRMA. Yeah, let's see. Birthday rule, fairly useless. Only way to bypass underwriting is to take another plan from the same company you already have. I think you can downgrade but not go up, if that makes sense. Yes, you can go sideways, or so from a G to a G or an N to an N, but you can't go from an N to a G. You can go from a G to an N, but you can go to another company. Maybe there's a company that has a better price. So again, reach out to my guys, and 100% free. They will review all your plans, and now is the time to do it. If you got it, wow, so many people have contacted me and said, hey, they just this company, company canceled my plan. And there's going to be a lot of people that letter from their Medicare Advantage plan, particularly in their Part D plan, not Medicare supplements, but Medicare supplements they can cancel you if the company goes out of business. But mostly right now it's Medicare Advantage and Part D plans. And I guarantee you, in tens of thousands of hundreds of thousands of kitchen tables throughout the country, there's a letter there from that person's Medicare company that says you're canceled, and we're not going to switch you to another plan. You're done. You have to go find your own plan. And it's going to sit there on their kitchen table for a week or two, and then they're just going to throw it away. And then January 1st, when they go to the doctor, they're going to find out that they don't have health insurance, and they have to pay the other 20. They'll still have Medicare Part A and Part B, but they don't have, they have to pay that 20% and the co-pays and the co-insurance. And so, this is going to be very, very bad. So please, if you let's check your Medicare Advantage plan, your Part D plan. Click on that, call, reach my people, and they have over 100 agents that can help you out, and they'll review all your plans. Miracle on 34th Street. It's an awesome system. Can you be deemed Can you be deemed disabled by Social Security and not receive a check if you don't have 40 quarters? That's basically SSI. So if you do not have 40 quarters, then you're not applying for SSDI, Social Security Disability Insurance. You're applying for SSI, Supplemental Security Income. So, but if you're applying for Social Security Supplemental Security Income, they'll have to ask you questions about your income and resources. So, you can be deemed disabled, but then you'll get an SSI check. I was told my Medicare Advantage plan is canceled. Yeah, there we go. So in my county for 2025, thought I heard you say once that opened other options because of being canceled. Yes. What are those? Yes. Thank you I should have added that when I was talking about that 30 seconds ago. A lot of people are happy that they're being canceled because, if you're, 67, 70, 75, and you're like, wow, I'm just tired of, Medicare Advantage plan and the prior authorizations and the networks that are always changing. I wish I'd have got a Medicare supplement, but I can't now because of my health. Well, if you've been canceled, guess what? You can. You're in a guaranteed issue. So so check out that option. If it's not in your budget, then at least check it out, and then you need to So call the number there, click on the little thing, talk to my people. Um, and number one, say, I was canceled. Yay. How much is Medicare supplement going to be? Can I get a Medicare supplement? How much is it going to be? And they'll give you the numbers and you figure if it's in your budget. Again, no networks, no more, no more networks, no more prior authorizations. If your doctor says you need it, you get it. And then if it works in your budget, more power to you. If it doesn't, then say, yeah, that just doesn't work in my budget. Yeah, let's just go ahead and put me back on on another Medicare Advantage that hasn't been canceled in my area. And they'll go through the whole thing. Okay, what doctors do you want to continue to see? What prescriptions? And this company has an awesome algorithm for finding the best prescriptions. And they have this awesome thing they just came up with. If you've got the over-the-counter thing, which a lot of people don't use because it's such annoying, they came up with this other thing to find over-the-counter stuff for you. Yeah, so I'm so excited that, yeah, anyway. So anyway, I love awesome customer service, as you can see. So that's why my office was the best in the country for customer service, my Social Security office. Not because of me, because I had awesome staff. He did file. He's getting now since last year. I have no way of contacting. Oh, if he did file, okay, you're the one with the independently entitled divorced spouse. Yeah. So if he did file, he's getting now since. If I have no way of yeah, he shouldn't. They shouldn't need to get in contact him. I thought he hadn't filed. So unless this is a different person, I'm thinking of a different chat here. Anyway. I'm on a Medicare Advantage right now, and of course, my Part D is going to go up. Do you think it's still better to have a Medicare Plus supplement? I always recommend, again, if it's in your budget, a Medicare supplement, a Plan N or a Plan G all day long, every day. If it's in your budget, yes, please. Those are the ones I recommend. But unfortunately, a lot of people they're just not in their budget. So they get a Medicare Advantage, which is fine, as long as you keep up on it every year and check it and make sure you're in the best plan for that particular year. Just don't let it ride. The Medicare insurance companies, they want you to just say, that's an hour out of my life a year that I just don't have. So whatever they do to me, they do to me. Please. Yeah, don't. I've been married for 50 years in September. I'm 69, she's 71. 50 years. Wow, congratulations. Told her she needs not work once we married and she only had a little time working prior. Is there a way that she can collect off of my benefit? Yes, absolutely. If but you have to start receiving benefits on your record because you're currently married for 50 years. Congratulations. You have to collect benefits on your record. So as soon as you file, then she files a spouse claim on your benefits. She doesn't have to have paid ever or worked ever. It doesn't matter whatsoever. Those are spouse benefits. And because she is 71 years old, she will receive exactly 50% of your benefit amount, your full benefit amount at your full retirement age. And if she is on your record, if anything should happen to you, she'll be automatically converted to survivor spouse benefits when you pass away and everything. So that'll make some people say, well, it's only $5. So I don't want to. And then I say, yes, I understand it's only $5 now, but when that terrible day happens and you lose your spouse, you're going to have so much more to worry about. And rather than getting, dealing with the Social Security bureaucracy. So if you're already on that person's record, it's automatic. It's called an auto conversion. Can you put in future earnings guess like years 2025 in a calculator? Yeah. Go into ssa.gov and set up an account there and all that stuff, which I recommend everybody go in there and set up an account, and then you can kind of manually put in future years to kind of guesstimate what your benefits will be in the future. You said that the amount you see on the website of what you will get is an estimate. Do they, in your experience, under or overestimate it? Yeah, all the time. But the closer you get to that year, to your full retirement age, the more accurate it is. But if you're, Jim, if you're 65, or if you're 55 years old, then yeah, it's going to be a big estimate because it's estimating the next, 12 years of earnings. So if you make a lot more in the next 12 years, then that benefit is way off. If you make a lot less in the next 12 years, that benefit is way off. So, but the closer you are to your full retirement age, the more accurate it is. My ex-husband moved somewhere in Mexico. I believe he is getting Social Security. Whenever he passes, will Social Security be notified? Therefore, I will know I can get survivor benefits. I live in Washington State. Yes, anybody that lives overseas, they receive a contact from Social Security, email or snail mail. Um, Usually they send it to the address overseas, and then that person has to return it. And if they don't return it, then the benefits are stopped. They Social Security, figures you have passed. So yeah, if yeah, you don't know where he's living. So yeah, that's going to be a tough one. So if you get a hint of his passing, from somewhere, then you'll need probably the death certificate and then file for survivor benefit. So yeah, yours is going to be a little bit difficult. But again, if the problem is people move overseas, like he might be in Mexico, but he might be using a US address, a friend or a family or, a virtual post office box or something like that. So Social Security, doesn't know he's living overseas, or over the border in this case. So they will just continue benefits, until probably 100 years old or something. How they usually do it is when you eventually get Medicare, or they send you your Medicare, and you send you something and you don't respond, then they know something's going on. But if you've got Medicare and you haven't used like Medicare, and you're like 70s, 80s, and 90s, and you haven't used your Medicare at all, that's another indication that maybe you are no longer amongst us. I can't thank you enough. Your advice helped me so much get what was owed me. I now get $2,700 versus $479 I was getting. Thank you. All right. Look at there. All the people that liked and subscribed and shared. Again, as I always say, I'm just some guy that worked in the bureaucracy forever, running my mouth for an hour, but it doesn't help anybody until y'all share. And somebody shared, somebody pushed that one like button or shared button, and somehow it got to Kathy, and she was able to hear me babble on, and she got her money. And so it's a team effort. So yes, awesome, Kathy. Good deal, team. Great job. How long to be married to your spouse to collect a survivor pension from him? Okay, so survivor benefits, it's not, if you were divorced, you had to be married for 10 years. If you were married to the person when they passed, it had to be 9 months. There are a couple exceptions, and the exceptions are if the person passed away before 9 months, but it was an accident, then that's an exception. If the person passed away while active duty in the military, line of duty type thing, then that's an exception. Today, I got a notice from Advantage Policy is being canceled. Yeah, another one in Texas, and so discouraged. Yeah, so you're probably not in the big cities like Austin or Dallas or Houston or something like that. You're probably, one of those small towns like I went to high school, Paris, Texas, so 25,148 population. So I'm sure pretty much everybody in Paris, Texas has gotten canceled too for, well, most of them. Because those companies have decided, well, we're not making enough money in those areas, and we're making some, but not as much as we want. So bye. We'll focus on the places we make tons of money. So you have to find another plan. So call my number there, the 888 number, and then press 1, and you'll get in touch with my new awesome team. What state are you in? Yep, I ran the Social Security office in Las Vegas. So I'm in Nevada now. Want to raise the cap. What do you want? Yeah, I talk about the policy, and I try to avoid getting into politics as much as possible. I'm a one-trick pony when it comes to here. I want to save Social Security and Medicare and make sure it's here for us, you, your kids and grandkids. So I don't care, what if it's a donkey or elephant. I want the policies. But in terms of the policies, the current one, yeah, that's the best solution in my estimation. But I've talked about that in several videos, so I won't talk about that now. Have called Social Security several times to get amount I might be eligible for my ex. Can't get appointment because waiting on hold each time for 2 or 3 hours. How do I get an appointment or talk with someone? Yeah, right now, because of the low staffing levels, basically the only time they're going to give you an appointment is if you're actually looking to file a claim. So if you're 55 and want to find those numbers, it's going to be difficult. You have to, persevere. But if you're eligible to go ahead and start those benefits, if you're 60 for survivor or 62 for pretty much everything else, then say, I want to file a claim for survivor benefits or spouse benefits. And they'll say, okay, we'll set you up an appointment. It'll be next month or 2 months from now. And then you go in there and you get the numbers. And if you like the numbers, you pull the trigger and you start this money. If you don't, you say, oh, okay, well, thank you for the information. Bye. And that's it. And yeah, the person that helped you will be super happy that you said bye, because that means they won't have to take your case back to their case and their desk and adjudicate it. So you've just saved them 5 minutes. I'm sorry he claimed last year at 62. I am 67. I have no way of contacting him. I wish I could say they said I will. Yeah, no, that makes 100% no sense whatsoever. No. The only, no, they shouldn't have to contact him at all. You've been talking to a new Title II CS, Title II of the Social Security Act, a claim specialist. Yeah, there's no reason for them to contact him. If he's already receiving benefits, he's already reviewed his earnings record. So it's good. They don't need to contact him for anything, unless they think he died. But yeah, that has no relevance. How would they contact him? I have no idea. Yeah, there's no reason for them to need to contact him at all. If you have to have, I'm sure you already have the marriage certificate and divorce decree, and you're not you're requesting it from him. You have the marriage certificate and divorce decree, and no, I would talk to somebody else. They're giving you wrong information. They have no reason to contact him whatsoever. So, and if they deny you, just file an SSA 561, file reconsideration, and they will reopen it. And a technical expert in that particular office will look at it, and then they will go over there and slap the hand of the person that helped you, and give them training. I don't know about the slap the hand part, but anyway. Or rather than going through I would just say, hey, I like to talk to an OS, an operations supervisor, about this, and say, my ex has already filed. This is not an independently entitled divorce spouse case. He's already filed. Why do you need to contact him? And yeah, it'll be taken care of. That's, yeah, crazy. I think both parties are punting on Social Security for the next 5 years. No changes. Yeah. I like to have a little bit of faith in someone. Yeah, I think yeah, I'm I mean, I can't not agree, because that's basically, we've known about this problem for the past 10 or 15 years and really haven't done anything about it. So yes, the writing's on the wall that both are basically punting, or one party wants to do something, but they need the other party because of the votes of the split and everything like that. So I have to be called every day for over a week, 120 minutes wait time. Leaving my number does not work either. No return calls. Yeah. So what I would do, I don't know if you're calling the local Social Security office or you're calling the 800 number. The 800 number is usually better in this particular case. But if you're not getting any satisfaction from either of those, then call any office in the country. And then when you call that office and say, hey, I want to check on my case, and that person says, we're not your office. And you're like, as I always say, I say, okay, I want you to walk outside the building and read those big letters on the outside of the building. Does it say Social Security Administration? Yeah, it does. Well, then you are my office. So shut up and answer my question. I wouldn't be that old Marine Corps sergeant coming out there, but yeah, that every office in the country is your office. But if it's a pending type of claim, yours is pending, but it's on the system, so anybody in the country can look at it. They might not be able to adjudicate it, but they can at least look at it. Most of the time that works. But if it's a pending claim that there's actually paperwork in a particular office on somebody's desk, then yeah, you have to talk to that office. But if it's already something in the computer system that anybody in the country can look at, then anybody in the country can look at it. Wow, holy cow. Someone just donated $99.99. Great channel, wonderful information. Thank you for being so helpful. Wow, thank you so much. I appreciate it. Wow, that's one beer Weir. That's a lifetime supply of beer there. All right, I'm definitely going to use that for coffee. Wow, thank you very much. I appreciate it. You guys are awesome. All right. Overjoyed. I ended up an Advantage plan because my Part D plan was so bad. My only option during SEP. Yeah, well, my Plan D plan was so bad. What? So if you just have a Part D plan, a standalone Part D plan, that means you had a Medicare supplement plan. So the Medicare, because you can switch your Part D and stuff, but most Medicare Advantage plans come bundled with Part D in there. Um, so yeah, Medicare Advantage. I wish there was a better system. I wish again. I talk about this a lot. I wish we didn't have to have Medicare Advantage or Medicare Supplement or anything. I wish original Medicare Part A and Part B would cover everything that should cover it because we paid FICA taxes for all those years. But until we get that changed, the only options are Medicare Supplement and a Medicare Advantage plan. And I recommend Medicare Supplement and then Medicare Advantage, but it takes a little bit more work to keep up on your Medicare Advantage. Let's see. If someone didn't have 40 quarters while working, how can they be eligible for Social Security at 62 if they never went back to work, receiving one check on their own record and a second on spouse's record? So if someone could be the person is 62 receiving disability benefits from SSI, and the disability benefits or the SSI, they're also receiving spouse benefits. But the spouse benefits are under $943, so they're receiving some spouse benefits plus the remainder up to $943 for SSI. So that's how that can happen. Started Medicare Part B this month with Advantage plan. Do I have 6 months to change to supplement plan if I wish? Yeah, pretty much a year. You have kind of a trial right period type thing. So yeah, but it really depends on your particular state. Each state, that type of thing is regulated by the states in terms of health underwriting and all that kind of stuff. So I would, again, click on the little QR code there and click on the little thing. You need help with Medicare, or call the 888. Press 1 and you'll immediately be connected with my partner for Medicare. And please, please let me know if you contact my Medicare advisors. Please come back and tell me the customer service, whether you're happy. And that's one of the reasons I switched, is because, yeah. I called my Medicare Advantage plan and they said they couldn't send me notice of change until October 1st. They are so slow. Is that normal? Yeah, the annual notice of change should have been kind of sent out in September. I guess because of all the changes, they allowed companies to be a tad bit late. But you don't necessarily need the paper version or the email version. You can, again, get in touch with your insurance broker if you know somebody that you know and trust, and they'll be able to look it up on the computer system and see exactly what you have and what's available in your particular area from all carriers. But again, one of the problems with brokers is, well, this particular insurance company is probably the best one for you, but I'm not contracted with it, so I'm going to do this one because this is where I make money, and that's what I hate, and that's why I decided to partner with this new company. And that's their calling card, is if they're like, oh, this other one's better for you, call this company. And so I love that. That's awesome. So yeah, if you need help, just give me a call. The 888 number there, press 1. Yes, so there we go. Let's see. If my wife retired and I'm on disability, can she file for my disability? No, she cannot file for your disability. She can file if you're at least 62 years old and you're receiving benefits. She can file for benefits on your record. If she has to be 62, you have to be 62. So if there's extra money, if your benefit amount is twice hers, then she can file for spouse benefits on your record. I'm in the Medicare election process of 3 months before my birth month and the birth month and 3 months after to choose. Retired military and use VA. Should I get Part B or forego? That's a individual decision. If you're happy with the VA, but one of the problems, I'm old Marine Corps sergeant, so military is, sometimes they're awesome, sometimes not so much. So your VA, in your area might be awesome now, but 2 years from now, 3 years from now, the customer service might deteriorate, or you might move to an area that doesn't have a good VA system. And if you decide to go ahead and sign up for Part B, then you're going to lose, you have to pay a penalty, 10% for every 12 months. But there is a way to have your cake and eat it too. That is, go ahead and sign up for Part B, and you're like, I don't want to waste $174. Well, then you sign up for what's called a Medicare Advantage Part B give back. If there's one available in your area, it will pay all or part of your Part B premium, and it'll give you some other benefits. So you have your cake and eat it too, because you paid for that cake. When all the money you paid into Medicare for all those decades, that's where that money comes from. So you paid for the cake, go get it. So again, reach out to us and my team can see if there's something available in your area that pays all or part of your Part B. All right. Guadalupe, my significant other and I have been together for 29 years now. He has been on Social Security disability about 15 years. His benefit is a bit over $1,200. If we married, would his benefit amount increase? It depends on how much your benefit amount is. If that's his full benefit amount, your benefit has to be more than $2,400 for him to receive anything. So yes. Yeah. So your benefit amount has to be over twice his full benefit amount. So his benefit amount might be 1,200, but he might be paying for Medicare. So his benefit amount is actually 13 or 14. So yours has to be 28. So Carl, I'm 62 on SSDI and have Medicare. At 65, will I be able to apply for a Medigap plan without underwriting? Yes, Carl, yes. So when you're on disability, it looks like a lot of people are on disability here today. So let me go through this. When you're on disability, your disability will continue to be disability until you hit your full retirement age. Once you hit your full retirement age, it'll switch to retirement benefits. The check and everything will stay the same. But there's other times in your life that you need to do something if you're on disability. If you're on disability and you turn 60, you're eligible for survivor benefits if you're ever married to anybody that passed away. When you turn 62, you're eligible for spouse benefits. If you're married to someone and they're receiving benefits, or you're married to somebody that was at least 62 years old and their benefit amount is twice yours. When you turn 65, this is what Carl is getting at. When you turn 65, if in your state, the only thing you can get as a Medicare Advantage plan, because you're on disability, when you're 65, that all goes out the window. You can get on any Medicare supplement plan available in your area, and they can't deny you for health. They, can't deny you. They can't charge you extra. So evaluate that. Definitely check that out and see if a Medigap, same thing, Medicare supplement plan is better for you. So yeah, reach out to us and we'll help you out. Here for Texas. Oh, okay. Yeah, I know exactly where that is. I'm 55 and getting ready to go on SSDI, and my expected SSDI payment is $2,700. Is that amount accurate, even though I'm not close to full retirement age? That's your disability benefit amount is basically what your benefit amount would have been at full retirement age. That's how it works with disability. So that's why people, they come in here all the time and they say, I'm on disability, but I'm 62 years old. Should I go ahead and file for retirement benefits? I'm like, sure, if you want a 30% cut, because 62, if you file for retirement, it's a 30% cut. But you're on disability, so that means you kind of waited till your full retirement age. So yeah, yep, that's so $2,700. That means you worked a couple hours in your life. So that's a good number. The average Social Security check in the United States is about $1,900 this year. So. All right. Yep. So it looks like Penelope jumped in there and says, yep, that's your full retirement age benefits. That's correct. I'm on SSDI and I'm 59. My ex-husband died last year and I only get 71%. Yep. Why don't I get 100%? Will it ever change? No, it will never change because you're received it at 59. So you're receiving what's called disabled widows benefits, and you get 71.5% of that person's primary insurance amount. So it will always be 71.5%. So it won't change. And obviously you'll still get the COLA increases and all the rest of that stuff. Let's see. Roxanne, is there anything in the Social Security manual you can point me to show that I'm entitled, even if they can't get in contact with him to avoid denial? He got his benefits last year at 6. I was going to send you the thing for the independently entitled divorced spouse, that link, the policy manual, but that's not your case, and contact him. But yeah, there's nothing in the policy. There's over 20,000 pages of policy, and unless it's something very, very strange where they think that he filed his claim fraudulently, or I've taken, tens of thousands. I've had in my office, the third busiest Social Security office in the country, we've had hundreds of thousands of retirement claims. And I can't think of one case in my office that we had to contact an ex-spouse that was currently receiving benefits. Yeah, so there's nothing in the policy manual because, yeah, it's like, yeah, because that doesn't happen. So you just got a new employee. You just got someone that doesn't know what they're doing. Long story short. So ask for an operations supervisor. My Plan D coverage changed January 2024. They re-tiered my medication without notice. Yeah, yeah. Medicare said the only way to change before April was to choose a 5-star Advantage plan. Was it going broke? Yes, that is. There's special enrollments throughout the year for Medicare Advantage. One of them is if you move, obviously, if you have a dual eligible plan, that means you have Medicare and Medicaid, you can change several times a year. If you have the extra help with prescription drugs, you can change several times a year. If there's a 5-star plan in your area, you can change to a 5-star plan in your area. There's all kinds of other special enrollment periods based on natural disasters and all that kind of stuff. So yeah, if you're completely 100% unhappy with your Medicare Advantage, they're raising prices and something like that, then, it doesn't hurt to check, all times of the year and say, is there anything special I can do? And especially now, now you can definitely do it because starting October 15th, you can change your plan and the change will take effect January 1st. So getting inundated with mail from healthcare plan. Yeah, it makes me crazy. Yes, I agree. Do you have a cheat sheet for all the rules? No, all the rules. Yeah, no, that'd be impossible. Yeah, I tried doing, yeah, tried to do it, and it just got longer and longer and longer. And yeah, I might try again. Yes, I might try again, but it'll be several pages because there's so many different. Oh, Chris, thank you for the great information. Super helpful. Oh, another donation. You got wow. When you see me tomorrow, I'm going to be so wound up on coffee and stuff. I'm going to be jumping off the wall. So you guys are awesome. Thank you very much. My accountant to delay receiving Social Security payments until 2025 because of future IRMA. Can I apply for Social Security now and request and retro payment for 6 months? I became 70 in 2020. Oh my gosh. Accountants. Yeah. Well, yes. If you're after 70, after your full retirement age, they almost automatically, if you refuse 6 month of retroactive, won't give it to you. But yeah, that's easy to get 6 month of retroactive. Yeah, if accountants, yeah, accountants give out so much wrong in Social Security information. But in your particular case, that might have been the smart thing or whatever the case may be. But yeah, once you file for benefits, then your Part A starts. It doesn't necessarily mean your Part B starts. And the Part B is the one that gets the IRMA. So again, if you've got some life-changing event that you stop working or something like that, then you can get that IRMA overturned. Oh, we're way over time today, so I always like to keep these to an hour. And let me get one more question. We'll call this the last one. How much can I receive for survivor benefits I collect at 60, or should I wait till I'm 61? So yeah, if you do it 60, it's the full reduction, 71.5% of the benefit amount. But what that benefit amount is depends on some variables. So what I would do is I would call to get definitive numbers. That way you can plan accordingly. It's always good to plan. Call Social Security and say, hey, I want to file for survivor benefits, even if you don't want to right now necessarily, but you can't get an appointment to talk to a retirement survivor expert without an appointment. So you say, I want to file for survivor benefits, and you go in or answer the phone when they call, and you say, okay, 60, how much? 61, how much? 62, how much? And then You can say, okay, well, give me 30 seconds to think about this, or let me call you back tomorrow once I crunch the numbers, and I'll tell you whether to push the button or whether we're going to start it next year. So that's the best way to do it. All right, so that is it for today. I appreciate everybody. I really, really do appreciate all your help, and we found some money for over $2,000 for someone today. That is awesome success story. So thank you all for doing